Hello, this is Dr. GERARD Cuomo. I'm here with patient Bernice, and she is transferred over for one appointment today to have her IMZ implant bridge evaluated for repair, and it is in the upper right. She also expressed an interest in getting opinion of the lower, which is somewhat loose now. I noticed on the lower bar that there was some wear occurring on the left attachment, which is in the position just mesial to 27. These are Dalibana attachments as well as some slot attachments on the distal. So there's a total of 1, 2, 3, 4, 5, 6 implants which hold a bar, and there are 4 attachments, 2 of which are slot attachments distally, and then the 2 Dalibanas. So this one is being worn by our upper new crowns that were placed on this lingual aspect of, I believe, number 7. So Bernice, just close down together and air on the mirror. And you can see how number 10 is wearing that Dalibana down. So we have to address the fact that we may have to number one, if we could tighten the sleeves of the Dalibana attachments. I don't believe the slot attachments, other than just cleaning them out thoroughly, can be adjusted. And see if we can get this to have a little more vertical attachment. There was an interest and possibility of redoing the lower. I didn't notice any fracture lines or any perforations through the lower. It seems to be very solid and still supportive of the attachments. So we're going to try to at least give her some vertical stability. It may not be today, we may have to address it another day, but our mission right now is to look at the upper. We're going to go ahead with the patient's consent now and move forward. First thing we need to do is just untighten this set screw, and just gently out, please. And just gently. Let me have some floss, please. And cotton plier. Okay. I'm just going to head and tie some floss around our driver as a safety feature. All right. Okay, we're back in the mouth. I don't want to gag her. She's got quite a gag reflex, so you might have to take that in and out. Does that suction bother you at all? Okay. Open up a little bit wider for me. Thank you. All right. And wider again for me. Okay. And there's our screw. All right. Need a pick and stick. Yeah, thank you. And open again. Thank you. Okay. gold instrument. And slide suction underneath. And see if we can just re-rotate this. I think we're just about out with this screw. And just turn it a little bit more. And turn it with this Explorer. The last threads, and do it with this driver again. And open up again. Okay. Okay. Let me have the microsuction, please. Now we're just going to check the threads after we backed out the main screw holding in the housing. And we're just going to go down and suction up any debris that may be caught down in there first. I'll do that first. Excuse me. I'm sorry. Okay. Very good. Transferring out. All right. I'll lift that off. We're going to look immediately underneath into the superstructure. And we'll take some video of this. All right, so we have a housing. We've got a distal 2 block and nothing on the mesial. Probably prior, at one time, it was joined to a natural tooth. It looks like that is a connector that was sectioned. Okay, so there are the 3. This goes in a cleaner. And we're noticing some irritation, a little bit of bleeding going on in the area of tooth number 4 and 5. Alright, so we'll need cavity cleanser next.
Doing okay? Great. You're just cleaning the area, okay? This is a little brush and cleaner, that's all.
And you can tell there's some movement involved. And we'll need a cotton roll next. And I'm just going to place a cotton roll under your lip. Suction and retract the lip a little bit. I'm just going to pull your lip up just a little bit. Well, we notice there's a little bit of the threads that are showing above the crest of the soft tissue. And I want to say on all 3 implants. But implant in the number 4 position seems to show the most irritation. This will come out and we'll put this in a cleaner, tartar and stain remover, and be able to assess what's underneath. that irritation should steady, should go away and decrease if we can get this off, and our goal is to make sure that it's stable. And we did order some new parts for this case. I think the main thing is to find out what type of sleeves, if they're 1mm sleeves. For an IMZ case, we're dealing with the 4mm IMEs and 1mm TIEs, so the transmucosal elements. If they're all 1mm, we should be in good shape. Change. Hmm? No. Okay, I'm going to do this in one more segment. We're going to start to undo the frame. We'll be right back to discuss the next steps.